back to the idea that a person presents with symptoms, no matter whether they're physical symptoms or mental symptoms. We're always trying to understand the reasons, the underlying cause of why these symptoms are being produced. So one therapy we use is ozone saunas. So those toxic residues from chemicals, etc., again, are stored in the fat just under the skin, called the subdermal fat layer. The easiest way, most effective way, is to get those toxins to come out through the skin through perspiration.
Got it.
The other avenues where the body will detoxify, which we can use juice fasting or water fasting or modifications in their diet, that will help to detoxify through the internal excretory pathways. So if you put a person on, let's say, a water fast, the body has to maintain its glucose levels. And how it does that is it will pull fat out of fat cells and turn that into glucose. So when the fat is coming out, when the body needs to maintain glucose, the fat is pulled out of fat cells, these residues come out. And then the body has to deal with these residues, toxic residues. So we do colon hydrotherapy to clean out the residues which are being metabolized through the liver, gallbladder, and then excreted into the intestines. We help the body by evacuating those through the colon hydrotherapy more rapidly, so they're not reabsorbed again.
And I love hydrocolon therapy.
Yeah,
since I've been introduced to it.
Yeah.
It's amazing, all the toxins that you store in you forever.
Yeah.
And like they never get out. They never get out.
Yeah, or just recycled back through the system again.
Which makes you sicker because you've got all these toxins that just stay in your body.
Yeah, so you got the toxins coming out of the fat cells, and you have the recycled toxins coming back into the gut. So it's good to get those out as quickly as possible. The other area of the body where these toxins are stored is in the lymphatic fluid. So we have the blood circulation, that fluid. Toxins can leave the bloodstream and be in that fluid, which bathes all the cells and tissues of the body. So that's like
so we're bathing in toxins inside
we can
our
bathe
body.
In toxins.
We have to get rid of those toxins.
Yeah.
Now you mentioned ozone. It's like ozone. That's like, how critical is ozone, and what exactly does it do for the body?
Yeah, so this is, a lot of people don't understand that ozone has been used in clinics since the 1930s, 1940s for various reasons. And there are many countries that, let's say, can't afford the expense of a lot of pharmaceuticals. They use ozone in their hospitals. I'm talking about Russia and Cuba and various countries that have incorporated a known medical approach to treating pathogens in the body. So ozone is what's called an oxidant. So of course people have heard about antioxidants, vitamin C, vitamin E, vitamin A, things like that. And then there's the other side, which is oxidants, which the internal body, the miraculous internal body, is always having this balance of antioxidants and what's called redox potential oxidation, keeping that in balance, because the oxidation is what helps to kill off pathogens in the body. The white blood cells produce hydrogen peroxide, an oxidant, to kill off pathogens in the bloodstream. So we can use ozone in different ways. Ozone saunas, we use ozone intravenously, we use ozone in the ears for various reasons, or even sometimes what's called rectal insufflations, introducing ozone rectally for some different conditions, but that's not the usual approach. So that's how ozone is used in a medical facility. Yeah.
So, I'm really intrigued with the dark field microscope.
Yeah.
Testing.
Yeah.
I mean, I love this. Explain this to me.
So dark field, all that means is it's a microscope which the field or the background is dark. Most hospitals or other clinics would use what's called a bright field. So the background is bright. But just like you cannot see the stars in the sky when the sky is bright in the daytime, when the sky gets dark or the field gets dark, you can see the stars. So just like in a microscope, if the background is dark, you can see much more about what's going on in the blood.
And explain that so you just get blood from your finger.
Yeah, a little finger prick. You put that onto a slide with a cover slip, so the blood is sandwiched so it spreads out evenly. And what it helps me see is, to some extent, the quality of the red blood cell, or if there's a difference in the size of the red blood cells, which a regular lab report, what's called a complete blood count, which tells us about the number of red blood cells. That tells me some information which is very important, looking for anemia, etc. Doesn't tell me anything about, let's say, the health or quality of the red blood cells. The same is true with the white blood cells. You can see the white blood cell under the dark field microscope. The blood report tells me how many, but if I can look at the white blood cell and see how big it is, or if it's active, or if it looks like it's actually crawling across the slide, I know that their immune system is turned on. It's
How
an
many
active immune
cells
system.
can you see from that one little prick of blood from a finger?
Well, it's not,
Quite a bit.
It's actually, you bring up the drop of blood, you put the slide on the cover slip on top, and it's not even a whole drop of blood.
Wow.
Hundreds and thousands of red blood cells.
So could you tell, for example, beginning signs of things from that was happening to somebody's body?
Well, you can see that maybe they might be predisposed. I mean, you can also see, and it's not that controversial, I don't feel, but I can also see in the blood if there's any fungus or molds that has a certain mucus appearance to it. If I see that, I say, likely your home may have molds in it, and there's a mold kit that they can take home and check their house for molds. It may have been a previous exposure house they lived in. One lady came in and said, I think my home is clean, but I did live in England in a damp house that was really old, built back in the 1900s. I know there was mold, so it may be something that's been kept from the past. So that's really important to help diagnose possible issues, underlying issues, being mold still present in their system.
Got it.
You can also see bacteria in the blood, but bacteria, the bacteria in our bodies, everybody has bacteria, will live longer than us, and how they survive so well, and maybe not that bacteria, but their generations of other bacteria, they will stick themselves onto the membrane of a red blood cell, because no white blood cell is going to ever attack sort of a red blood cell. So on the slide, we have to sort of cross the red blood cells apart, and we see if there's what level of bacteria might be in the blood. And
And then what can you do to help somebody that has, bacteria in
an
their
infection
blood?
of some sort. So what we try to do is we try to mimic what the body is already doing, what the white blood cells are already doing, and that is the white cells are producing hydrogen peroxide. But very often with a chronic low-grade infection, you look at the white blood cells and they're not even moving. They become sort of overburdened, and they're not really sensitive to knowing there's a bacterial infection. So we simply can do an oxidative intravenous therapy using either hydrogen peroxide or ozone.
Awesome.
But also, the question is, why is the person's immune system not able to overcome the pathogens?
Because you're looking for the cause,
we're looking
not treating just the symptom.
And we're looking to support what the body would love to do, and that is get rid of the infection. So we also support the immune system in a lot of different ways.
Nice.
Yeah.
So I was sitting here the other day, and you had a gentleman here that has stage 4 cancer, and he was ready to get the chemotherapy. Can you talk to me a little bit about how you help cancer patients?
Yeah. Well, again, this is a condition, a diagnosis, a symptom, etc. So looking for underlying cause. It's the same with everyone, no matter really what the condition is. You're looking in their history, looking what insults, where they lived, what their home environment was like, all those things that have contributed to the issue. And I'd say one important underlying issue is gut ecology. So that tube that runs all the way through us, the environment of that tube has a huge influence on the physical body and also on the mental body. So we look at the gut ecology.
Wow. I also met a lady in here that had headaches for years. And she came to you and you suggested, you asked her if her modem was in her bedroom. And what does that have to do with headaches?
Oh, that may, I shouldn't mention her name, but
Yeah.
yeah. So that was an interesting case, and that was that when she first came, she was having insomnia and headaches. And through various testing, we found that one of the issues was low progesterone for her. Her production of progesterone was extremely low. So in a way, to try to help her ovaries to produce more progesterone is a long-term thing. It takes a long time to get that working again. So we simply use bioidentical progesterone, the same progesterone. It's made from yams or soy.
Wow.
Introduce that into her system and take 150 milligrams before bed. Within 3 or 4 days, her sleep completely changed. Her headaches were gone. So she was fine for 2 months. Then they came back again. So, you're still doing the progesterone, a few other things we mentioned. Yeah, I'm still doing the same thing. Well, then what's shifted? What happened? And what's going on in your bedroom? And just started investigating what's going on. So I explained how to ground or earth her bed.
Now that I'm dying to learn about, because I'd like to explain how to
which
do that.
helped. But then what else happened in your bed? Oh, my husband moved in the router, the Wi-Fi router into our bedroom.
And you wouldn't think that would
You
who
wouldn't
would
think
think
it,
that a
but-
little tiny
Yeah.
modem is going to cause
Yeah.
headaches, right?
But when people have chronic issues, they become very sensitive, much more sensitive than most people to environmental things, especially radiation, cell phones, Wi-Fi, things like that.
See, and I looked it up on the internet, and they say there has to be a lot of radiation in that little modem to go through all the walls in your house.
Yep.
And so the source of it is going to be more powerful, the radiation from the source of the modem. So
Yeah. So she moved it. Her husband moved it back out again, and we earthed her bed, and that took care of that issue. So her